This is the Less Insurance Dependence podcast show with my good friend Gary Takas and myself, Narain Arul Raja.
We appreciate your listenership, your time, and most of all, we appreciate your intention to reduce insurance dependence in your practice. Our goal is to provide information that will help you successfully reduce insurance dependence and convert your practice into a thriving and profitable dental practice that provides you with personal, professional, and financial satisfaction.
Hello, everyone. Welcome to the Less Insurance Dependence podcast, the official podcast of the Reducing Insurance Dependence Academy, www.rid.academy. Membership to the Academy is a gift from Gary and I in appreciation for your listenership. Visit rid.academy and don't forget to register. By registering, you will have access to all of our resources and a free pass to all of our events, including our annual summit. I am Narain, your co-host. Today's podcast is titled Impact of AI Auto Denial of Claims and How You Can Adapt as a Practice. I really love this topic, Gary, because everyone knows this is happening. You know, we talk to the companies selling the software to the insurance companies, as well as we talk to the dentists. So we know this is not theory or guessing game. We are 100% sure insurance companies are using AI today to deny claims, right? And the beauty of AI is it's easy. You know, press a button and it will go and deny 10,000 claims for you, right? You don't need to hire someone, pay someone, manage someone. It's all like one button, done, right? And if again, I hate to say it, but if I'm running an insurance company and my head of AI comes and says, do you want me to deny 10% or 15%? I'll say deny 15%, right? Because now I make more money, more profits. Like I'm being very, pragmatic capitalist, right? You know, anyone who's working to increase profits, that's what would say. What's your take, Gary? What are you saying?
Yeah, I mean, I wish this wasn't a topic we needed to discuss on a podcast episode.
Yeah.
AI auto denial of claims. I wish that wasn't even a phrase.
Right.
But it is. It is. And the reality of this is, let's talk about dental insurance 101. How does a dental insurance company make money? They take in premiums and they don't pay claims. Take in premiums, don't pay claims. That's it. We're done. You now have a PhD in dental insurance economics.
Right.
Take in premiums, don't pay claims. That's how they do it. And they put all kinds of provisions in the plan that makes the hoops that the patient or the dental office has to jump through in order to get the benefits. And, here's the irony of it, Aaron. Do you know that today, as we're recording this in early 2025, there is a huge segment. It's a little bit of elusive to get the actual data, but it's been estimated that over 30% of people that have dental insurance never go to the dental office. They have it, but they never go. Well, how's that work for the insurance company?
Wonderful.
They keep all the premium.
Yeah.
Never go. Here's another statistic, Aaron. This number I have a better handle on. Only 22% of all patients that have dental insurance utilize their maximum benefit each year. 22%. And that annual maximum is pretty pathetic. What was it? What was the annual maximum when dental insurance was created in the 1960s? It was $1,000 a year.
Right.
But go back in history. Back in the 60s, a crown, I have the data on this, was typically $150. And it covered it 50%, meaning the patient paid $75 and the insurance company paid $75. How many crowns could they get with their $1,000 benefit? It's between 13 and 14.
Yeah, 13 or 14, yes.
It's 13 point something.
Right.
Okay. That's not a full mouth reconstruction, but that's a lot of dentistry.
Right.
Fast forward to today, and there are still many insurance plans that have the same $1,000 award. And the crown, what's the crown fee today? I mean, does that even pay for one crown? If it
Barely.
doesn't need a root canal. But if it needs a root canal, now we're over
Ah,
the annual limit.
right.
So look at the difference there. You know, now granted, there are plans that have increased $1,200 a year, $1,500. We see some at $1,500 a year, but that has no way kept up with inflation, you know, compared to what it was in the 1960s. So it's
Let
just
me-
made more and more profit, you know, for the insurance companies. And now with AI, they're able to reduce their costs because it's no longer a human being at a computer reviewing claims and finding aberrations in the claims. It's AI.
Right.
And that's why we're seeing right now a radical spike in denials of claims. And my crystal ball says that is, you know, what CEO is going to give of an insurance company is going to give up that? None.
None.
Because that's an easy pathway to massive profit, massive dividends, massive increase in their stock price. That's an easy one. However, as I've said for as long as any of you have been listening to this podcast, there's 4 entities that are involved in the dental insurance game today. There's 4 entities. There's the dental insurance company that provides the insurance. There's the dentist that provides the care, the patient that receives the care, and the employer that bought the plan. Those are the 4 entities that are involved in dental insurance. The only one that wins today is the dental insurance company. The other 3 lose. The dentist loses because he or she has to take a massive haircut on their fees to be a provider. The patient loses because of all the games the insurance company plays. There's going to be some upset patients on these claims denials because
Gary, I want to
see more denials.
Yeah, I want to kind of piggyback and kind of go in a specific direction, which is we know it's happening. We know with AI, they're denying more claims, and that's because it's good for the insurance company's bottom line. Now, I'm a dentist. What's the impact of that on my practice? Like, for example,
well, let me complete the discussion of the entities, because entity number 4 is the employer that buys the policy. They lose because we're quite literally getting gouged for the premiums that they're being charged.
right,
They lose.
versus the coverage, which is like peanuts.
But to answer your question, what does a listener do with this?
Right.
I wish I could tell you that there were some good ways to counteract AI auto denial of claims, but there aren't.
Well, you could hire an army of people to fight the insurance company. I guess you could do that.
You know, claims, anything, you know, my heart goes out to team members that are our insurance coordinators.
Right.
That is a hard job. But oftentimes that's staffed by a more entry-level position.
Right.
And that works against you, doctor, because now you've got someone that doesn't know the nuances of the narratives that need to go with claims, what attachments need to be gone with claims, isn't paying attention to the different wait periods relative to the claims. And now we've got an entry-level person that's just up to their eyebrows, struggling with managing their job responsibilities of submitting claims. And it plays to the insurance company's benefit. I don't have a great answer on what could a dental practice do, you know, to fight this auto denial of claims, except the obvious answer is don't be a participating provider of PPO plans.
Right.
There's the way you take control of it.
So you would start with the one that perhaps is auto denying the most. Obviously, I know you have a 6-step process.
No,
Huh?
I would just look at it from a global position and say, as the owner of a practice, I can't fight these giants, the insurance company. I can't get the reform. I want more things to be covered. I'm going to lobby for that. I'm going to do all that.
Right.
Yeah. It's social justice that should happen here, and that's not happening.
Right.
The best thing you can do is recognize what, you know, it's that old adage, change the things you can change.
Right.
And this is something, what you can change, and you have 100% control over this, is whether you participate or not. That's what you can. We can whine and we can complain all about, you know, the gravity of it all. and how unfair it is, and how insurance companies are making billions and billions and billions and billions of dollars by denying claims. We can do that.
Right.
And at the reform level, my crystal ball says we may, emphasis on we may see some reform at medical insurance, at health care insurance level. Because many times the things that are getting denied on the medical side are life and death.
Right.
We may see it there, although it's going to take some really high noble politicians to get that pushed through because of the lobbies.
Right.
But we may see some change there. But where is dental insurance reform going to fall? Way lower on the priority list.
Right. Nobody cares. Nobody dies.
We're not talking about someone dying because a root canal wasn't covered.
Right.
It's not good. It's unfair. It's a bad investment on the part of the employer. But we're not dealing with life and death.
Right.
What's the worst that can happen dentally? Patient loses all their teeth. That is not good. What's the worst that could happen? Patient would have to have dental implants and restored mouth. And, there's...
I mean, you could argue that there is an oral systemic connection and the person dies of some kind of a disease.
Because of the infection in their gum, sure.
But you're saying it won't point back to the insurance company, dental insurance company.
No, it's not going to point back there. The causal agent's not going to point back there.
Right.
So, recognize the things you can change, understand the things you cannot, recognize the things you cannot, recognize the things you can change, take action on the things you can change.
That's a great
change is your participation. No, nobody is holding a gun to you, doctor, to say you have to be a PPO provider under Delta.
Right.
You do not have to. It is we have choice on that. Now you may think, emphasis on think, that you have no choice. And why would a dentist think that? Because maybe 80+% of his or her patients are coming from the PPO plans. But your past doesn't have to be your future. You don't have to do that.
Right.
You can successfully resign. And let's remind everyone that we teach, at least in my coaching, we teach a very patient-friendly way of going out of network. There are other consultants that say, just wash your hands of insurance, hand the patient a claim form and say, good luck. Collect from them at time of service and say, good luck. If you want to get reimbursed, send your claim in and good luck with them. I could not disagree with that more. We teach our clients to be very patient-friendly. Let your patient know they can choose your office for their care. They can use their benefits right here. You'll file their claims for you like we always have. We'll follow up and we'll advocate for you. And we'll be on your side to help you get every dollar of benefit you have. When most people hear that, if you have a relationship-driven practice and they know, like, and trust you, they don't want to go anywhere else. They say, really, it's not that different. And I don't want to go anywhere else. Let me stay here.
Right.
You're going to lose some. I wish I could tell you there's a way to resign, not lose any patients, but I've never seen it happen. But what is the experience we do have in our coaching base is when we look at the loss of patients after following our 6-step plan and doing all the training and getting the team raring to go on this, we lose way fewer patients than you ever thought. And you push through the other side, and the other side, it's blue ocean. It's wide open. And imagine now you don't have to worry about what's happening with dental insurance reform because you're outside of the loop. And you spend your time focusing on the things you do have control over. But it's a sad development to have to report AI auto denial of claims. That's a sad, I'm sorry to have to report that. However, I'd be remiss not to report it because it's real and it's happening. And it's only going to get worse because your deck is stacked against you.
Let's say somebody's listening to this podcast and they know their claims are getting denied by AI and they're just done. They're like, 2025 is the year I'm going to do something about it. I'm going to recommend they talk to you at the very least, just to see what you think and if they are the right candidate or if they can actually do this. So that's what we call a coaching strategy meeting. Yep. The link is thrivingdentist.com/CSM. This is our New Year's gift to you. Have a conversation. Gary is open to having a conversation once with the practice to see if you will benefit from this. What else would you recommend, Gary? And also, can you talk more about what happens?
On a social level, write to your representatives. Let your voice be heard. I'm afraid it's a little bit like shouting into a vacuum. But let them know. let them know that this isn't right, this isn't fair. Get involved in organized dentistry. We have a brilliant ADA president in Brett Kessler, Dr. Brett Kessler. Get involved in organized dentistry. Brett is working hard on a national level to get some reform done. It's an uphill battle, but you don't have a voice at the table unless you're a member. Those are some things you can do, but I think those are more social change and long tail. I wish I could report it differently, but those are maybe long tail results, take a long time. But any of our listeners, if you want to talk about something you can do fast, any of our listeners, if you'll apply the 6 steps to successfully resign from PPO plans, train your team up, replace Delta for marketing with organic search engine optimization for marketing, which they could do with you, Equa, Naren, by the end of this year, by the end of 2025, you could be exactly where you want to be, which would either be fee for service or a radically reduced footprint of PPO plans. You don't have to go all the way to significantly improve your practice. Maybe we decide that there's a stray plan or two that makes sense for you to keep because of your community, because of your employers, because of the fee schedule. Maybe we get a decent fee schedule. But by the end of next year, this year, you could be where you want to be compared to those that are mulling about, just complaining about what's happening. I'd rather be in control of it. Well, this has been a fun episode. If you didn't know about AI auto denial claims, now you do. And unfortunately, it's not a great story from our perspective to have to report, but it's happening, and it's only going to get more. It's only going to become accelerated, and it's only going to create more pain and suffering and aggravation for you. But the great news is you have control, and I would encourage you to exercise that control. Well, Naren, on that note, let's put a ribbon on this. If you'd like to set up a marketing strategy meeting with Equa, what's the right?
Yeah, the link is equa.com/MSM, ekwa.com/MSM.
And that's where you'll learn how to master organic search engine optimization so that you get on page 1 of a Google search instead of relying on Google or relying on Delta to provide you patients. And then if you'd like some help with this, like a guide to help you navigate this, a Sherpa to help you navigate this, go to thrivingdentist.com/CSM, schedule a Zoom meeting with me, and we can talk very specifically about your practice. And I'll share with you whether you have a fighting chance at this or not. I have zero interest in telling a doctor they can do this if they really can't. So I'd be happy to share with you my perspective on that. On that note, thank you for the privilege of your time today. Naren and I will connect with you on the next Less Insurance Dependence podcast.